Located in southern Africa, Zimbabwe gained independence from United Kingdom on April 18, 1980. This developing country has several problems that inhibit its development. The main problems that we believe need to be addressed are economic corruption, gender equality, and sanitary conditions. Our proposal to combat each of these issues and further develop Zimbabwe is the focus of this video. We believe that in order to further develop Zimbabwean society, it must reallocate funds to local business to decrease poverty levels, require all children to attend schools, and provide government funding to improve sanitary conditions in schools, houses, and public health buildings. Doing so will reverse the corrupt economic conditions and indirectly improve all sectors of Zimbabwe's society.
Under Executive President Robert Gabriel's supervision, Zimbabwe has seen 30% economic growth in the last 5 years. Opening Zimbabwe to accepting foreign currencies as legal tender and ceasing to print money has contributed to the economic recovery. Zimbabwe's recovering economy has stopped extreme hyperinflation, but hyperinflation and unemployment continue to plague the country. According to the CIA's official fact book, the unemployment rate in Zimbabwe has risen to 95%. With the trend of economic recovery, the unemployment rate should experience relief. Reducing the cost of living and improving employment mobility will further improve the economy and reduce the unemployment rate. The country could engage in a social welfare program such as Brazil's Bolsa Familia. The Bolsa Familia program funneled a couple $100s per month to 22 million impoverished families with the stipulations their children remained in school, got vaccinations, and the adults sought employment. The program reduced the poverty rate by half and unemployment to under 7%. Reducing housing costs, continued improvement of gender equality, incentivized employment mobility, and social welfare programs will drastically reduce poverty, unemployment rates, and improve the economy.
Poor sanitation and lack of clean water in Zimbabwe has led the country into a state of crisis. According to UNICEF, only 34% of Zimbabwean people have access to an improved water source, 38% of the population lacks access to improved sanitation facilities, and 32% of people resort to open defecation because they do not have access to working toilets. This is critical because it causes germs to rapidly spread and puts entire communities at risk. Residents resort to drinking water from dirty, contaminated wells, which rampantly spreads diseases like diarrhea and typhoid. Zimbabwe lost thousands of lives and hundreds of thousands were harmed due to a massive cholera outbreak in 2008 to 2010. Rural areas were hit harder than urban areas, though according to the CIA, the risk of infectious diseases spread through water is extremely high throughout the entire country. The spread of these diseases could have been prevented if there was greater access to clean water. Water treatment chemicals and machines should be purchased to make water available for drinking and bathing. Communal toilets and showers should also be built so people have alternatives to public defecation. We also propose to build a stronger national pipe system to send clean water from urban areas to more rural areas so that all people can have clean water. Finally, distributing sanitation supplies such as soap and toilet paper would improve overall hygiene. This plan will help people to live longer, healthier, and more prosperous lives, which will greatly benefit the whole society.
Following the model of Brazil's Bolsa Familia program, we have calculated that it would cost $683 million, which is 0.5% of Zimbabwe's GDP, to fund each section of our program, including funding local businesses, building adequate schools, and providing sanitary conditions for schools and houses. This is modeled after Brazil's program, which gave $65 to each individual living in poverty. However, this is not sustainable because it is so expensive and would not allow Zimbabwe to gain any human capital. Therefore, we're proposing to reroute funds that are already in Zimbabwe's economically corrupt government and use just 10% of the country's GDP. This will allow us to achieve our mission, increase the quality of Zimbabwean life by rebuilding infrastructure in sustainable and healthy ways, and also address poverty, economic corruption, and unsanitary conditions.
In conclusion, we believe that the major problems in Zimbabwe's society that are inhibiting its development are all caused by economic corruption. Because of this, the majority of Zimbabwe's money is not accessible by average everyday individuals. This directly results in the large percentage of individuals living in poverty, as well as the lack of accessible health care, sanitary conditions, and adequate school conditions. These economic factors create the differences in quality of life and opportunities for people of different socioeconomic statuses, as well as encourage gender differences and disparities through lack of access to equal education and health care. Therefore, we believe that this economic disparity is one of the first problems that must be addressed in order to advance Zimbabwe society and further its development. As we've suggested, Zimbabwe's government must continue its dollarization program, which, according to the World Bank, lowered its inflation levels in 2009. Rather than retaining its money in the corrupt economic system, Zimbabwe should create a microloan program to bring money to local businesses and decrease poverty levels, as well as require all children to attend schools and provide government funding to improve sanitary conditions in schools, houses, and public health buildings. There are several implementation risks for these proposed solutions, including the Zimbabwean people disagreeing with money going towards these goals, corrupt officials keeping the resources for themselves, the government returning to mass-producing money to fund these programs, or citizens rebelling against these new practices since they are so different from what they're used to. However, each of these steps are necessary to eliminate economic corruption and disparities in Zimbabwe to further Zimbabwe's development. Therefore, this misdistribution of money must be reallocated as Zimbabwe's highest priority.